Practicing medicine without insurance is possible. Imagine a private practice where you get to see your best patients every day, providing medical services you truly enjoy, all without the hassle of insurance. My name is Dr. T. Nguyen, and I'm a recovering specialist who was completely burned out from insurance-based medicine. I pivoted into direct care, where patients pay me directly for my medical services and have never looked back. If you're a private practice owner or planning to become one who's looking to be free of the grind of insurance and you're craving simplicity, efficiency, and connection with patients, you are in the right place. This podcast will help you map out your exit plan and uncover the mindset needed to thrive in today's economy. Welcome to the Direct Care Podcast for Specialists.
Did you guys notice that there is a button on the bottom of the podcast section in the show notes that says text or email? I think that's really cool because somebody did use that button and their question was, do you have any advice on how to market to patients as direct care? So it looks like their challenge is that their patient number has dropped since leaving insurance. And as soon as they find out they don't take insurance, they don't want to be scheduled. I love this topic because it's going to teach you a couple of things. The first thing is, if you had an insurance-based practice, you have been marketing to people who never really wanted to pay out of pocket. Even if they're paying co-pays, their deductibles, and their premiums, they're not really looking to pay more. And I think the biggest scam of all is insurance in the first place, where people think they're getting a great deal by paying these monthly premiums only to get hit with these enormous deductibles, $5,000, $8,000 to meet before the benefit kicks in. That is not unheard of. That is a very normal thing. So not only are they paying into their premiums, when they go to the doctor's office, they also have to pay a copay. And if they haven't met their deductible, they're going to pay the insurance rates for that service for that day. So we really have to teach ourselves first about the economics of what health insurance is really doing. And there are some benefits, of course. We're talking about financial protection from catastrophic events like a stroke, car accident, things that we really can't predict. It is money saving because otherwise you'd pay out of pocket for those trauma services and hospital utilizations and resources. But I'm talking about a private practice where we're not really providing that type of care. Most of what we do is generally elective, maybe a laceration here and there, but it's not life-threatening necessarily. So when we're looking at the business model, not taking insurance is the most financially feasible model because we're not held to the insurance rates, which are usually hyper-inflated. So if a person comes into your office, make sure you have some cash prices so that they can compare and see that paying out of pocket is a lot cheaper than buying health insurance. That's not to say that consumers need to choose one or the other. It's really to allow them to see that they can shop around and it's up to them how they want to pay for their care, whether it's through insurance or directly to the doctor. And they certainly have to measure up to what the value they get in return. And some people don't mind the existing option with insurance where they're spending 5 to 7 minutes with a doctor. Whereas people with more long-term problems, chronic health issues, or simply don't want surgery, they are often seeking other options because the conventional way of medicine is sometimes lagging behind. And there's a lot more options when you look outside of the insurance system. So with that said, having an understanding of who you're serving is so important. If you have a direct care practice, you are not serving the individual who wants to use their insurance. So if you're coming from an insurance-based practice, you have already swam in the pool. You have already gone fishing in that particular type of pool for that particular type of fish. So if you take insurance, you have self-selected for people who want to use their insurance. What does that mean to you? That means you have to find another pool, another pond, another lake, whatever your analogy is going to be. Find another place where they are actively looking for help. They are actively paying out of pocket already, and they already know and are pre-educated to understand that there is a higher level of care outside of insurance. What that means is you cannot rely on your existing pool to serve your direct care practice. Only a small percentage of those people will convert. And they will only convert if you prove that there is a better measured outcome, or you have a service that isn't available with insurance. So you are leveraging non-covered services, for example. If you have a pain practice, you are going to be leveraging non-surgical options. That is the best way to do it. That's not to say that you won't also get surgical patients. You certainly will, especially those who don't have insurance and they just want to know the price of things and not get a surprise bill at the end of the year. But for the most part, direct care doctors are often leveraging services that aren't covered by insurance. So you have to think about your practice very differently. You really have to think about, why are people paying out of pocket elsewhere? And you can look into your community and see if cash practices exist, not just in your specialty, but other medical services or healthcare services. In my area, there's physical therapists, nutritionists, chiropractors, acupuncturists, functional health, integrative health, alternative options, and so on. The list is very long, to people who are providing health-related services or medical services without insurance. So look within your community to find the evidence where people are paying out of pocket. What are they doing? Some of these practices have really honed in their marketing. They are targeting people who are getting lost through the insurance maze. These are often people who just need a little bit more time with their doctor to understand their diagnosis, to understand their treatment options, and really have that empowerment to know that they can choose in-network options or out-of-network options. So we can do that for people. We can give people another option. So where do you find these types of people who are willing to pay out of pocket? My first recommendation is to align yourself with practices that don't take insurance and learn from them. So take them out to lunch. See if there's a way that you can build rapport with them, have a relationship with them that's helpful to both sides. So for example, me as a podiatrist, I love working with chiropractors. They offer great hands-on care. And for me, if that hands-on care is not enough, or they need diagnostic modalities, I offer that as a team effort. So it's not that I'm stealing patients, because I definitely don't do manual manipulation. And they don't prescribe prescription drugs or imaging studies. Maybe some do, but not to the extent that I can provide that service. So you can see there's a puzzle that we can fit in different places. Now, do I market to other podiatrists? Not necessarily. It's a small community. We're friends. We all know each other through associations and networking and social events and things like that. So they are often curious about what I'm doing, and I share that. I say, I take care of things that you don't want to take care of. Simple as that. For me, I love taking care of people who just need more time with their doctors. Whereas patients who call me as their first option, usually not a good fit, because the people that I serve that I know very clearly are generally individuals who either don't have insurance or they've tried their insurance options and it's not enough. Which means if they have insurance, I'm totally okay if they're going to choose an insurance option because it makes sense to them. I'm not fighting for that patient. What I am fighting for is for people to understand, if they're struggling with something, this is their option. And yeah, good things cost money. Can't expect everything to be for free. So if the individual is struggling with something and they're, doctor shopping around, and they've gone through so many other doctors, so many other options, and they're not getting resolved, that's where I'm a great fit. And that's where I get to educate the patient and say, I know you've tried all these things. Why don't we try a different route? Why don't we try another plan? Because now I have time, I have the skill, expertise, and the evidence that I've helped others. And so with that reputation, with me marketing my practice for 6 years now, for as long as I've been open, I'm keenly aware of who I serve and who I don't. So if you're looking for the next couple of steps on how to market your practice, it's to look within your circle and to focus less on people who are dependent on insurance and find your people, those who are already paying out of pocket, those who are open to that idea, and think about promoting more of your non-covered services. I think an easy way to do this is to offer something as simple as a phone consultation. You can do this for free, or you can offer a low dollar amount. And what you do with this is you say, we know that insurance is important to you, but here's how we're different. Give us a call. We'll talk about your treatment options. And if this is a good fit for you, we can proceed. And if not, nobody's time's wasted, right? You don't want the patient who is trying to use their insurance to choose you first. You're going to find those people are going to end up very frustrated. They're going to keep poking at you for a super bill, for coding the right thing. You're going to find yourself back in the circle of dealing with the insurance mentality where they are going to ask a lot from you administratively. And maybe you don't have the capacity to do that. Maybe you do. That's totally up to you. But in my practice, I really don't mess around with billing beyond an office visit. Once in a blue moon, if I do a surgical procedure, I might provide a CPT code, but I also say I can't guarantee payment and I can't guarantee accuracy because I don't study CPT codes. I'm a surgeon. I'm a doctor. I study how to get people better. So it's the way you frame your offering. So to circle back, how do you market to patients as direct care? You have to go in a different pool, a different lake. If you're looking for cash payments, connect yourself with other cash practices, become good friends with them, learn from them, offer your services, deliver what you're promising, get good rapport within your community, give community talks, gather your Google reviews, sharpen up your website to reflect that you offer value, and get people to really highlight your services through those testimonials. If you offer them non-surgical pain solutions, make sure that they talk about it in Yelp, in Google, on Facebook posts, wherever you're collecting testimonials to reflect the service you're highlighting. Because people are going to learn non-covered services are simply great because they're non-surgical options. They do produce results and it's out of pocket. So I hope that this information is helpful to you. If you have additional questions, please do utilize that button down below in the show notes to ask me a question, and I'll answer them right here for you as soon as I get them. Have a wonderful holiday break. I will be out for the next 2 weeks, and I'll be back in 2025. Take care, everybody.
If you enjoyed this episode, please give it a review and share it with a friend so more doctors can learn about direct care. Let's keep the conversation going on LinkedIn so we can help more doctors escape insurance and thrive in private practice. Thanks for listening. I'll talk with you next time. Take care.